And this is our patient today. His name is GVAC. You know him from Weird Medicine. He's the cackling hyena with titanium turds. And what have you got for us today?
I have something I've had on my face my whole life, a tiny little skin tag right on the corner of my eye that seems to be getting progressively larger. And I think it's about time to get it removed.
Are you okay? Oh my God.
Oh!
I'm going to do it from here.
He'll stand behind me. All right, let me know when you're going to start.
Okay. So what I'm going to do is I'm going to get a hold of this acrocordon or skin tag, and I'm going to use these scissors to just remove it. Now, if I used lidocaine to numb it up, it would take about 5 seconds to perform the numbing, whereas if I do it this way, it will only hurt for about 1/4 of a second. You ready?
I guess.
Okay.
Really?
You ready?
I guess.
Okay.
Ah!
How's that?
Is it done?
Yep.
Wow.
Yep, that's it, and it's not even bleeding.
Not even bleeding.
Really?
Yep. Ew, that's disgusting.
Fry it up and make crackling bread.
Ew.
Wow.
What do you think?
Perfect. Quick and easy.
No longer in your peripheral vision?
No, no fuss, no muss.
All right. So we'll go see, John should be cleaning up at this point. Oh! The hell are you doing?
Nothing. I was just picking up. I was just picking stuff up. Cleaning up.
I was trying to play the animation from Jay, aka Coke Logic, and he did a thing for Weird Medicine TV, and I saw Weird Medicine TV, and I pulled that, and then yeah, it played the old GVAC thing, so it kind of bummed me out a little bit. I really miss that guy. Nope, the audio issue is not on your side. Can you hear me now, though? Does it sound okay? Anyway, yeah, there you go. Hey, thanks, Vinny. And hello, Corndev. I saw him on Melton's wall today. I want to find out how I can get my name on Melton's wall. That's what I want. So anyway, yeah, the federal government's trying to kill me. That's only a bit of hyperbole. Let me tell you what happened. So I tested positive. I started feeling crappy at the movies last night. Fortunately, nobody was there except for my kid and me. And he's the one that gave me COVID-19. I started feeling crummy when I left. Muscle aches, pains, chills, no fever, cough, sneezing, nasal congestion, the whole thing. Tested myself, absolutely just grossly positive for COVID-19. I mean, it was instant. Let me see if I can, because I need to test this. Let's see. Let me share my screen with you. There we go. Yep. That's about as positive as you can get. So I called my primary care person and said, can you get me some Paxlovid, because I am at high risk for progression to severe disease because of the last time I got it. Let me see if I can find that. Gave me a thing called post-COVID bronchiectasis, which is scarring in the lung. Here we go. Scarring in the lung that causes tension bronchiectasis. Okay, so this is a normal lung on this side. What this is an MRI that is, it's a CT scan that is taken from the top of my head to the bottom of my feet as if it was slicing through my shoulders, through both shoulders at the same time. So you're looking, since I'm looking at you, this lung over here is the right lung. This over here is the left lung. Okay. And this is normal lung tissue. And this is bullshit. So that's scar tissue caused by COVID. And all these little dots that you can see here are microscopic bronchioles that now are enlarged because as this scar, you know what happens with scars? They contract, right? So they're contracting and it's opening up these little bronchioles. They're no longer functional. They'll just fill up with mucus. One of these days, this will kill me. And that's why, I got into it with Gino about the vaccine. I'll take any respiratory vaccine they can throw at me because of this, I'm at high risk for any respiratory virus, right? Okay, so anyway. Thank you, Corn. You don't have to do that. I thought you said you were doing it. Oh, I got all excited for a second. Okay, I can do that. The game board. I don't know. I don't watch Melton enough to know what that is, so I'm going to have to start watching. Yeah, okay. We will talk. Silvio, don't go away. We'll talk about that. Don't let me forget. So anyway, this is trying to kill me. And so I got out of the movies, felt shitty, went home and took my took a COVID test, and yeah, it was positive for COVID-19, as you saw. So I called my primary care, and she said, no problem, I'll call it in for you. 24-hour Walgreens, just start it right away. Should take care of it very quickly. Paxlovid is an amazing drug. It is, for the most part, variant independent, and it works as well as the monoclonals for keeping people out of the hospital. In other words, about 90% of people at risk will prevent 90% of hospitalizations. Sorry, if you have 1,000 people and 100 of them would go to the hospital, I'm just making up these numbers. If they're taking Paxlovid, only 10 of them will go. So it will prevent 90% of hospitalizations and a significant fraction of deaths as well. So, I wanted to get on it. Well, here's the thing. If I write a prescription for oxycodone 20 milligram tablets and the pharmacist only has 10s, they can substitute 2 10 milligram tablets to make 20 milligrams. It's no problem. They are empowered to do that. However, if you write 300 milligrams of Nirmatrelvir, I always get that one wrong. Is it Nirmatrelvir, which is one of the components of Paxlovid, and they only have the 150s, they won't give it to you. So she called me up and said, they don't have it. I've called 3 different pharmacies. All the 24-hour pharmacies in our area don't have it, but they've got tons of the 150s. And I said, well, the 150 won't do, but just tell them to give me 2 packs. I'll take the 2 150s to make 300, and I'll just take one of the 100 of the ritonavir, because Paxlovid is 2 pills, ritonavir and Nirmatrelvir. And you're supposed to take 300 if you're normal of the Nirmatrelvir and 100 of the ritonavir. And then if you have renal insufficiency, you take 150 of the Nirmatrelvir and 100 of the ritonavir. So just give me 2 packs. Just give me 2 packs, and I'll have 300 milligrams of the Nirmatrelvir, and I'll just take 100 of the ritonavir. You could do that with every other drug. If I order 50 milligrams of lansoprazole, if I order 60 of lansoprazole and they only have 30, they'll give them 2 30s. So she wrote 300 of this. They only had 150s stacked up to the ceiling. Nope, I can't give you that. It's like, why? It won't bill out that way. It won't bill out that way. That was the first pharmacist. The second pharmacist was a little bit nicer and explained it's the federal government. To be fair to people with renal insufficiency, they won't let you have 2 packs of the 150s because it wouldn't be fair to them. Okay, so I could literally kill someone with oxycodone, but they can substitute that. This shit could literally kill me and they won't give it to me. It's like, what am I supposed to do? So I'm going to tell you what I did, and I don't like it, but I wanted to show you this article. Yeah, I don't know why it looks like the Mad Magazine kid, Vinny. Yeah, I know what you're talking about. It's my sternum and the diaphragm. It just looks, it's weird if you're not a radiologist. But anyway, so here you go. Country running out of Paxlovid. Yay! As new wave of COVID-19 boasts demand. You know what else happened November 1st? They privatized this stuff. The federal government's not paying for it anymore, but apparently, sorry, they're still controlling it. Countries running low on the COVID-19 antiviral drug, Paxlovid. No shit. And look at the picture. Look at the one they have. Oh, here's the 150. That's the one that's gathering dust on the shelves that they would not give me. So the reason I wanted to do this is not just to bitch and complain about myself, but to tell you a strategy that you can use. And it's not a moral strategy. It's not an ethical strategy, but they've put me in a position where I have to act in an immoral way to get what I need. It says, we acknowledge the pressure supply issues place on the healthcare sector, so are grateful to those who have helped redistribute stock of Paxlovid to help ensure, well, you could make more, or you could go to people who aren't using it because it's underutilized in a lot of places and get them to just send it to you. The agencies were working with the distributor to get more. If the distributor has it, all they have to do is ship it out. It's, I don't know that the manufacturers manufacturing it, they don't want to have a whole lot of stock laying around unsold. That's my concern about this. I'm not a conspiracy theorist. I'm just thinking about how business works. Let's see here. Hospitals have a good supply of remdesivir infusion. Okay. Well, you know what's great about remdesivir is it works when you're not in the hospital. Once you end up so sick that you're in the hospital, it doesn't work so great. I think they really should be opening remdesivir clinics. And if you get COVID-19, you get IV remdesivir. The problem is it's 3 days of infusion. It's not easy to do. But what we found early on in this pandemic was remdesivir was okay, but it wasn't the panacea we were hoping for once people get sick. But the studies that have been done since then on the outpatient remdesivir for like people like me, it's like magic. And it also is variant independent as opposed to the monoclonal antibodies, which I got the first time. I got Delta. That's what did that to my lung. But anyway, public immunity waning. Well, okay, right. But we're not seeing people are getting it, but we're not seeing the just hordes of people in the hospital that are requiring us to close wards and put people in the hospital on ventilators and stuff. We're not seeing it like we were there. So Jim, yeah, I'm feeling well enough to do this, but still sucks. Sucks ball meat. But anyway, all right. So let me tell you what I've had to do. And thanks, man. One dev. Thank you, my friend. So what I've had to do is say, I'll take the 150s. So there's 5 days worth. If I take 2 150s and one of the nirmatrelvir and take one of the ritonavir, damn it, that's driving me crazy. I know I'm saying it wrong. Nirmatrelvir. Oh, I was saying it right the first time. No, nirmatrelvir. Okay, if I take 150 of the nirmatrelvir, 2 of those, I can make up the 300. Then take the 100 of the ritonavir, I can make up the the normal dose that I'm supposed to take. Problem is, it's going to run out in 2.5 days. So what I'm going to do is I'm going to lie and say I lost my prescription. Can I have another one of those packs? Because this sucks. And again, for the people who are tuning in late, go listen to the beginning why this is so ridiculous. Oh, what, you don't have 50s of the low sartan? Well, you can substitute 225s. If it's a controlled substance, you don't have the 60s of extended release morphine, they're empowered to give 230s. But you need 300 of nirmatrelvir, nirmatrelvir, and we only have the 150s. Nope. It won't bail out that way. Ugh. Anyway. All right. So that's how I'm getting around it right now. And hopefully this shortage will go away as the manufacturer realizes they need to make more drug. I know they can't just make a little bit. They have to make a lot, and then it sits around for a long time, and then they have to eat it. Well, you know what? Actually, Pfizer, I appreciate them for the things that they have done, and innovation in the oral medications. But I just, you can eat a few bucks to make enough of this stuff so that people can have it and not go, or just the federal government just say, yeah, you know what? You can give people 2 of the 150s if you don't have the 300s in stock. For F's sake. All right. Let's get to, let me see, Silvio, low testosterone on Reddit. The doctor wants to do vitamin D script first. Okay, so a lot of my colleagues are really dumb when it comes to testosterone. I've talked about this on the regular show. People who are watching this may not listen to that. So how do we define normal testosterone? Well, you take 1,000 people and you draw their testosterone, you get an average, which is the mean, and then you go 2 standard deviations from the mean. This is simplified, but this is about right. And then that's your normal range. So what if, though, 95% of people who have, why am I out of focus, who have low testosterone, see if I can get this thing focused a little bit better. Nope. Okay, well, that's going to have to be what it is. What if 95% of people who have low testosterone are going around undiagnosed, which is true. Only about 5% of people who have low testosterone are diagnosed and treated. That's what the literature estimates. So now you have a sample, a cohort, where there's a bunch of people in there that have low testosterone that are untreated, and they are contributing to the normal mean. And that's the problem. So they're skewing the curve downward. So that normal, that maybe let's just make up some numbers, that normal should be 500, but you have a bunch of people with low testosterone in the quote unquote normal sample, that they skew the normal down to 350. Now, if you have a testosterone of 360, some primary care providers particularly will look at that and go, well, you're normal. Let's try vitamin D first and see how that does. And when in fact, if you are symptomatic, what are the symptoms of low testosterone? Weakness, low libido, erectile dysfunction, physical weakness, these kinds of symptoms that also could be low thyroid, could be from sleep apnea, could be anemia. So all those things have to be worked up. But you have a low normal testosterone. If you're symptomatic, it should be treated. And if your doctor doesn't know enough to do that, first off, go to drsteve.com, click contact, tell me you're having that problem. I'll send you some literature that you can show to your provider. And don't go in there and go, well, this guy on the internet sent this to me. Just say, hey, I found this article. What do you think? Let it be their idea. And if that doesn't work, then go to a urologist that deals with men's health and get them to treat you. You know, the normal for a young man should be in the between 500 and 800 is what the urologists tell me. So most of them will treat a quote unquote low normal testosterone because they understand how those numbers got there. Okay. All right. He was all about it when I saw him in person. Now 347 and 74 freeze backing off. Okay. Yeah. Silvio, let me know what the normal range in your lab is. Because if it's like 350 to 800, that's part of the problem. Matthew, sorry it's not related. Why aren't we supposed to pop a blood blister? It just hurts more. You know, what I found is if I pop any blister, it hurts more. It doesn't seem to hurt while it's in the blister phase, but as soon as that skin under, that exposed dermis under that epidermis, because remember, a blister is just where fluid gets between the dermal layer and the epidermal layer, pushing the epidermal layer up. When that skin is exposed to the elements, it just causes inflammation. It hurts more. There's really no reason not to pop one. You just put a Band-Aid over it. People are worried about them getting infected because it is quite the culture medium. But in this day of sterile, environments and our ability to remain sterile in our homes on a local level, you put some antibiotic ointment on there and put a Band-Aid over it. It's not really an issue. All right, let me see. Oh, he's an endocrinologist. Okay. Well, they don't always deal with men's health. Just because they deal with glands doesn't mean they know. Look, I don't want to get between you and your endocrinologist. I'm just saying, email me. I'll send you some information. I'm not saying this person, he or she is a dumbass at all. There may be other factors involved that I don't know about. But, this is an error that is commonly made by people in the medical profession, in my opinion. And there's the king of all diffs. Thank you, my friend. You are the king of all diffs. Yeah, why does oil or Vaseline seem to help cuts and whatnot? Because it becomes an occlusive dressing. And we used to think that leaving wounds open helped them. Then we found that applying occlusive dressings to certain kind of wounds, in other words, occlusive meaning that it doesn't let air get in there, allows the white blood cells to do their thing and be able to move around and work. They can't jump through the air. So there needs to be fluid in the proximate area for white blood cells and fibroblasts to move around and do their thing. So that's why. All right, you too, man. You too. All right. Hey, thanks, Silvio. Yeah, I'll send you the info. I don't know. It's hard to get an endocrinologist to change their mind about something. We just talked about this on the last show about thyroid stuff. We had NP Mel B on. It's on YouTube right now, and it'll be on podcast in a few weeks, and it will be on SiriusXM this Saturday. But my wife had great difficulty trying to get her endocrinologist to listen to her because all they were looking at were numbers on a piece of paper. Oh, well, my friend, your thyroid numbers are normal. They're low normal, but they're normal. You shouldn't be feeling this way. And tried to pawn it off on depression. And in thyroid disease, you've got to listen to the patient as well, not just depression and not just testosterone. And you have to listen to your patients all the time or you're going to be making mistakes. I do like blisters for the fluid. Speaking of fluid, check out cameo.com/weirdmedicine. I will say fluid to your mama, or I'll say just about anything that you want. Obviously there are limits to my ability to have free speech on Cameo, but I'm trying to put that in here. I was so out of it today with this stupid COVID shit that I got into the shower with my socks on. I've never done that in my life. And now I kind of know what a demented person feels like in the beginning, because that's how it felt. I had no knowledge that I had done it till I felt weird, and I looked down. I still had my stupid socks on. So anyway, any validity to the stuff about your immune system being better at fighting off future viruses if you let it attack one without help? Yes and no. You can still take medicine. I'm taking the Paxlovid, but it doesn't cure me. What it does is it decreases the viral load, so it's easy for my body to clear out what's left. It still makes antibodies, and it still makes me immune to this particular variant and similar variants. I've been exposed to COVID for the last 2 years, and I haven't gotten it that I know of, because the Delta virus variant was so virulent that, my body made quite the immune response, even though I had monoclonal antibodies and was vaccinated before, a year before. So yeah, you still make an immune response, even if you get the monoclonal antibodies, because your body is cranking up for that, and it doesn't forget. That's the thing. You may not have antibodies floating around, but you have memory T cells and B cells that can generate antibodies at a moment's notice, and all of those things never forget. So anyone that says natural immunity isn't a thing is full of shit. All right. See that? I hear that from people who refuse to take vaccines. Yeah, I get it. I got influenza one year. It wasn't the swine flu. I was immune to that because of the swine flu came through in the 70s. But I took it, and it was only 6% effective that year. I got it. I had a fever of 105, stayed home and watched 4 seasons of Arrow on the CW. I was fine. And I attribute that to the influenza vaccine. The influenza vaccine is not an mRNA vaccine. It's a classic vaccine. I have no problem with it whatsoever. And like I said, I'll take any vaccine that they throw at me because of the way go back to the beginning. If you're just joining, I showed you why, because of the bronchiectasis in my lung. But anyway. Yes, Amanda. No, I get it. Yes, the weird part of medicine when I'm wearing socks in the shower. It was weird. Well, my socks are clean. I don't have to wash them now. If I piss into a jug instead of using a public bathroom, am I being cleaner? Well, define cleaner. I mean, pissing into a jug, okay, you got to put your whole member into the jug and not have any spray back. But the thing is, urine is sterile. So now public bathrooms are pretty gross, particularly if they have air dryers, from what I understand, that when you flush the toilet, you get some aerosolization of fecal matter, and then those air dryers just throw it all over the room. But you know what else is more disgusting is they did a study at, I think it was at Wrigley Field or something like that, where they watched people using the bathroom. And if they knew they were being observed, about 70% of people washed their hands. But if they knew they weren't being observed or thought they weren't being observed, only about 40% of people washed their hands. That's nasty. So the bigger thing is make sure you wash your hands well, and then don't touch the door. Every place should have, if they require a doorknob to get out, they should have a trash can right next to the door. So you use your paper towel and get the doorknob and then throw the paper towel in the trash can. If they don't have a trash can there, throw it on the ground right there, so that to alert them that they need to have one there. Now, bathrooms that have a sliding or a swinging door, it should swing outward. So you need to grab it to enter, but then you can use your elbow or your shoulder to get out. And just think about it that way, like you're going through surgery, just to get out of there. You don't want to wash your hands and then touch something that 60% of people didn't wash their hands after taking a dump. So, yeah, I think the flu shot is absolutely worth it, Jamingo. We had Barry the Blade was a contributor to our show, told us about truckers taking dumps in Walmart bags and throwing them on the side of the road. He said if you're cleaning up a road and you see a Walmart bag, make sure you handle it with tongs or something. He was hilarious and told us all about trucker duty. And he passed away from, I believe it was swine flu. And RDS, Richard David Smith, who is the owner of Hyperphysics. I'll put that in the chat. It's Hyperphysics, like Fizzics. It's the first energy drink for nerds. And he almost died from influenza. He ended up on the vent, and now he is a big proponent of the influenza vaccine. Influenza vaccine has been demonstrated time and time again to prevent death from influenza, even if it only is around 6% effective preventing the disease. It still helps prevent hospitalization. I was 63, 64 when I got it. Fever of 105 at my age is pretty serious. I took Relenza, which I prefer over the Tamiflu. It's the inhaled version. And I felt, I sailed right through it. So there you go. Question for another show. You can ask me right now. What's your question? Hey, thanks, King of All Dips. The evening is always the worst part. Start feeling crappy in the afternoon. I agree, Matthew. I agree, but it's all about what's on your hands, right? If you're going to eat, you're eating with your hands. You stick your finger in your nose, stick your finger in your mouth, wash your hands, and just use sterile technique getting the hell out of there. All right. Thanks, Logan Field. I wonder, Logan Field would just tell me to microdose and that would help. And he's probably not wrong. Yes, I absolutely can. I just did a Patreon about this, but I can absolutely talk about Matthew Perry and ketamine, and we talked about it on the regular show as well. So I'm getting behind in these messages. So let me talk about this. So people know I've been a proponent of at least having access to ketamine as an alternative to selective serotonin reuptake inhibitors. And so what I heard after Matthew Perry died and he had ketamine in his system is like, see, people sending me this. Ketamine's bad. Okay. Let me bring this up. Oh, well, how do I do that? Okay. Very good. I'm still figuring out StreamYard when it comes to sharing web pages. So, okay. Autopsy shows Matthew Perry died of acute effects of ketamine. And so here's the deal. This is what happened. He got an infusion under medical supervision a week and a half before he died. And then his autopsy showed high amounts of ketamine in his bloodstream. Well, ketamine's half-life is like 3 to 4 hours. So 3 half-lives later, 12 hours later, it's completely out of his system, probably undetectable, which means that he used ketamine subsequent to that. It says that the high levels of ketamine found in his post-mortem blood specimen, the main lethal effects would be from cardiovascular overstimulation and respiratory depression. Well, for goodness sake, no, I do not. He was also in a hot tub. So my recommendation is, number one, don't abuse ketamine. Don't abuse any drug. I'm not going to just say no namby-pamby type, as people who have listened to my show for a long time know. But it's hard to know the provenance of these drugs. It's hard to know what you're really taking and how much you're taking. And if he was abusing ketamine and then getting in a hot tub, my advice, this is going to save lives. If you're impaired in any way, alcohol, benzodiazepines, Ambien, ketamine, opioids of any kind, don't get in a hot tub I'm begging you, at least don't get in by yourself. Make sure that you're not the last one in there when all your friends leave. But I'm going to recommend you don't get in at all. The heat opens up capillaries, drops your blood pressure, can do all kinds of things to you, which would be, ooh, piping rock. Nice. But it can do all kinds of things to you. And if you drop your blood pressure, you could lose consciousness and slip under the water, and that's the end of you. So please don't do that. He was unconscious in a standalone jacuzzi. And then they put this, reported to be receiving ketamine infusion therapy. Okay, yeah, 10 days before this. That had nothing to do with this. Absolutely nothing. The ketamine that he took under the doctor's supervision or healthcare provider supervision did not contribute to his demise in any way. And that's this kind of stuff is the stuff that causes drugs. Okay, I have patients who are terrified to take transdermal fentanyl for their cancer pain. Why? Because it's all over the news and people are dying of fentanyl. Fentanyl's killing people. Getting it off the street in a little baggie where you don't know how much, and you've got some dealer going, well, I don't know, I'll put about this much in there. And then, and then selling it. You don't know what you're taking. It's so easy to overdose people using powdered fentanyl intravenously. But if you take it under a doctor's or healthcare provider's supervision, not impossible, but much less likely. Plus, we give people naloxone, where you do it in a very safe way. We start with the lowest dose and titrate upwards, all of those things. So, but that's the kind of thing that it hurts people. There are people who aren't getting medication. Hang on a second. Hey, you're on my live stream. You're on my live stream.
Oh, well, I was letting you know I just left Big Stone Gap and I've got your stuff.
Oh, thank you so much. I'm just explaining that to everybody.
Oh, okay.
Okay,
I'll drop it by.
Thank you.
Thank you.
You're the best.
Bye.
Okay, bye-bye. That's my partner. She found some 300 milligram Paxlovid. How about that? So I wish I had the sound effect. And she's going to pick it up for me. So anyway, it's the media, this kind of media stuff. Now people are going to go, whoa, ketamine's bad. It killed Matthew Perry. Yeah, it is bad when it's abused. Okay, that's fine. Okay. To be honest, I wash my hands before I handle my junk, not as much after. Brian Morton, who's a comedian, that's a whole bit he does is, why would I wash my hands after I touch my junk? I want to wash them before because y'all nasty. Before and after is good. Or you could be like Stuttering John. His hands never touch his genitalia. He uses his underwear to aim the urine. I'm sure it never goes all over the floor or the back wall. All right. Yeah. Hyperphysics.com. There you go. Shatai and Richard. Good job. Now, John Jamingo, let's talk about that. You got your flu shot today. What happens if tomorrow you get influenza? Are you going to blame the flu shot? A lot of people would. It's hard to convince them that if they got the flu shot on Monday and ended up with influenza on Tuesday, that the flu shot didn't somehow cause their influenza. But in fact, you were already going to get it. Let's say you were exposed to influenza on Thursday, then you get your flu shot on Monday, and then you get influenza on Tuesday as you naturally would from being exposed on Thursday. And it's really hard to convince those people that the flu shot didn't cause their influenza, but it is a sampling bias. Wow, Loganfield. Thank you. You don't have to do super chats. I mean, I appreciate it, but it's not required. Hi, pal. What's the deal with med beds, real or no? Okay, well, goodness. Also ever heard of dicyanin goggles? You supposedly see human auras. We used to have goggles that would allow you to see human auras. What they had in them was a feather. And you would look at somebody and it would make sort of this rainbow effect. And somebody found out that if you took feathers and put it between cardboard and put a hole in it, looked through it, you could see these weird effects. I don't necessarily believe in human auras. I mean, obviously, unless, I mean, what are you talking about? We give off heat, but is there some energy field that we give off? Well, detect it some other way. Show me what a bioenergy field is. I hear people talking about, oh, we manipulate bioenergy fields. Just show me what it is. Measure it and let me see that the intervention that you're doing, where you're saying you're manipulating the bioenergy field, that what you're doing actually changes something and that correlates with some beneficial effect. And then I'll believe it. I'll absolutely believe it. I just want to see it measured. So I'll look into dicyanin goggles. Hell, I'll buy some if they're not ridiculously expensive. It sounds trippy, at least. And then the med beds, yeah, it's coming. You've seen, was it Prometheus, Alien Prometheus, where they did a cesarean section on a woman who was pregnant with an alien. She was impregnated by her boyfriend who was infected by the alien black gunk. That stuff's coming. We'll have that eventually. My job will at some point be somewhat obsolete, although, I have to shift my bedside manner depending on who I'm talking to. And I just wonder if AI will ever be able to do that. We'll see. No, Matthew, I'm not saying that. We don't have any long-term data at all. We don't have long-term data. I'm saying this is a personal choice. I'm basically libertarian when it comes to this stuff. I think it should not be mandated by the government. I choose to do it because I'm old. What long-term effect is going to affect me? I'm not telling my kids to get the mRNA booster. My kid gave it to me. He just sailed right through it. So I am concerned about it. I'm concerned about immune activation. That's what killed cats in the mRNA or coronavirus vaccine trials. The cats would survive the first exposure to a coronavirus, and then the second exposure, their immune system went ham. And now we have not seen that in humans. It seems to be a feline effect, but who knows? So yeah, I'm very concerned about it just because we don't have the data. That's all. So yeah, please don't read that into what I'm saying at all. If you didn't see images of my lung, go back and watch the first part of this. You'll see why I will take any respiratory vaccine that they will throw at me. Tuberculosis, RSV, influenza, COVID-19. I'll take whatever they got. All right. Very good. Thanks, Logan Field. Thanks for the $5. So King of all diffs had the coof real bad, went to Tractor Supply, got the horse paste, worked in 3 hours. He'd taken horse paste. God, that pissed me off when they did that to Joe Rogan. The I word, I got to be careful. I got a whole video removed and I got a content strike for talking about legit research on clinicaltrials.gov. Let's go there real quick. I hate this keyboard. Clinical trials. Hang on. Yeah, Carl loves it when anybody does this. But maybe I'll edit this out. Okay, so I'm going to put in. Let me share this with you. It'll be a little bit more interesting if I just show it to you rather than me just talking about it. So let's go COVID-19. And let's put in the I word. All right. Okay, 93 studies. 93 studies. Okay, effectiveness of the I word as add-on therapy. Okay, here we go. I word nasal spray for COVID-19 patients. SARS-CoV-2 pre-exposure prophylaxis. But these people are not idiots. These are real clinical trials. Okay, there's a reason why this stuff was studied. It didn't pan out the way that, the scientists among us hoped that it would, as far as being able to generalize these, let's do 100 studies per page, the results, so that we could recommend that everybody take it. But it's not an animal drug. It is a human drug that is extremely well tolerated. And, it does have known antiviral effects. So that was why they wanted to test this, because wouldn't it have been nice if we had something off the shelf that we could use? So there you go. These things, look at these. Active, not recruiting. This one's going on. This one's completed. Unknown status. This one's completed, et cetera, et cetera. So there were real studies done by real researchers because they wanted to know. Now, here, this one is interesting. Favipiravir is the drug that I predicted back in June of 2021 would be our panacea for this. Never hit the American markets. It was the one prediction that I made back then. Well, I made two predictions back then that were incorrect. One was that most people wouldn't get it, and most of the people that did would not die from it. The second part was true, but the first part I had at the time it made sense. But the second prediction was that favipiravir is an off-the-shelf drug in Japan made by Fuji, that it could have been brought to the United States and just tried, right? It's already passed through phase 3 for influenza. Just do a phase 3 trial for COVID-19. I never saw it actually happening in the United States, but yet, we get molnupiravir, which is its first cousin. And, it's something, and it came out like a year later. So we could have had a therapeutic with some, real good chance of solving this issue very quickly. But anyway, so yeah, the I word is, people were not maniacs for thinking that it might do something for this. And, there's still data. There may be certain populations that it's really effective in. We just don't know. I can tell what things you search for with the pop-ups you're getting. Oh, really? I don't know. I don't think that's true. In some web pages it's true, but others not so much. Because I've not been searching for hard rock, erectile dysfunction stuff, unless it was for this show. Pick of 3 cranberries. Oh, that's weird. No, I did not know that, Logan Field. That is, I don't know. So are you saying that he did that on purpose then? From what everybody said was he seemed the farthest thing from being suicidal at the time. Not so much for tinnitus or tinnitus. It's always, my ENT professors always pronounce it as tinnitus. That's noise in the ear. There's lots of different noises. Some people's brains will turn the noise and try to make sense out of it, and they'll hear swing music or metal or classical music. Other people just hear a high-pitched ringing. See an ENT provider that has an audiologist in the office, and they will get you pointed in the right direction. There are some new electronic devices that can make things a lot better for you. They give you audio that is tuned to specific frequencies, and so it allows you to hear better, and you won't hear the stupid ringing in your ear. All right. Yeah, Rick LaBlanca, exactly. X-ray specs, my friend. He knows. So Rick's got to be old, or at least in my generation, because in the back of the comic books, you could buy these X-ray specs. And I remember paying $1, and it was like 4 months later they showed up. And it was just, you could hold your hand up and you could see what looked like bones. And what it really was is you were just seeing a diffuse image of the skin around the hand. And it looked kind of cool when you're 8 years old. It was neat. Anyway, is a residual benefit from prior years of flu shots. I usually get one, but haven't yet this year. Maybe. Well, yes and no. Okay, so I got the swine flu shot in the 70s. I also got swine flu. And when swine flu came around, if you noticed, it was mostly young people that got it and got really sick with it. And old assholes like me were the ones that didn't get it. It was because we were exposed in the 70s. So yeah, there is some residual. Now, the regular flu shot is a killed vaccine. So the immunity can wane. Getting exposed to a live virus tends to make better immune response, which was why the mRNA vaccine made so much sense, because you were causing the cells to make spike protein and express them on the surface as if they were infected by a coronavirus, and therefore the immunity should be more long-lasting and robust. Now, just because you don't make antibodies that last a long time doesn't mean that you're not immune anymore. All right, I'll take one more here. Oh, yeah, Johnson Smith. That's right. Oh, very good. Wow, you're bringing back all kinds of memories. Let's see if I can find a Johnson Smith catalog. I used to love them. They had all this, they were the Temu of our age back then. I loved their just crappy stuff. Let me see. Johnson Smith catalog. For people who don't know. Okay, yeah, let's. Hilarious. Thank you. Let's see if we can find one. Wow. Are they still in business? No, surely not. Mail order company established in 1914 by Alfred Johnson Smith, Chicago, Illinois. It sold novelty and gag items, such as miniature cameras, invisible ink, x-ray goggles, whoopee cushions. Yeah, fake vomit and joy buzzers. I was hoping that they had maybe some pictures from it, because it was really kitschy, old school stuff. Let me see here if I can find any images from the Johnson Smith catalog. Yeah, here we go. And that was what, I used to buy mail order magic tricks and stuff. Let me see if I can share this one instead. Stop that screen and present this screen. Yeah, there we go. That's a little bit better. Let me full screen that. So let's see here. Bag full of laughs, the electric laughing bag, vibrating shocker. A red flashing light. Wow, what a novelty. Two-headed nickels. Well, he's about as dumb as a two-headed nickel. He surely is. A midget radio. Oh, that wasn't very, very politically correct. Anyway, they had all kinds of stupid crap. Crazy bug-out eyes. Where's the x-ray specs? Hypnotism record. Flesh-eating plants. Oh, yeah. Well, okay, so this is before they banned the sale of these things across state lines, or they were Venus flytraps. At least I think they've been banned. I know for a while there were so many people. They're like one place in North Carolina. And, here's the x-ray specs. One place in North Carolina that had them, and they were getting endangered. So, and then a 7-foot balloon. I mean, this guy, he just, what can I find that I could sell for next to nothing and make 1,000% profit? Anyway, yeah, Loganfield says Brunswick County. So Loganfield, is it against some sort of code now to get Venus flytraps? Yeah, let's see. Oh, bilingual aphasia. Aphasia. No, I've never seen that. Why do people wake up from coma speaking a language they don't know? They don't. They may wake up having an accent, but let's say that they wake up speaking a Russian accent. They still don't know Russian. They can't speak Russian. That I've seen. Yeah, the flying ghost was a balloon trash bag and a string. And it's the greatest. They're just the biggest ripoff. Yeah, 4 to 6 weeks for delivery. Yep, I saw that. Oh, that's hilarious. Okay. All right. All right, my friends. Listen, I'm going to get out of here. I really appreciate you hanging out with me and letting me vent about my stupid crap. And I will see you next time. Same bat time, same bat channel, whatever the hell that means. All right, be good.